Assalamualaikum, my name is Nurnabila Natasya Binti Yusry. Today I will be presenting my final year project entitled Determination of Bioactive Compound related to Anti-ACETYLCHOLINESTERASE activity in Clinacanthus nutans organic extract under the supervision of Dr. Wan Rozianoor Mohd Hassan. Now let's begin with the background of study. Acetylcholine is the brain's important natural neurotransmitter which acts as a critical control in the formation of memories, verbal and logical reasoning, and the ability to concentrate. Principal role of acetylcholinesterase is the termination of the nerve impulse transmission at the cholinergic synapse by rapid hydrolysis of acetylcholine. According to Tu et al. 2019, nowadays, natural products have become very popular as a supplement or alternative medicine due to their efficacies and fewer side effects. Clinacanthus nutans is one of the best species from ANTI-AChE family that has been used in tropical Asia as vital herbal medicines due to its wide range of bioactive compounds. Let's move on to the problem statement. Tecrine, dopazil, and the natural product-based rivastigmine are some of the synthetic medicines that is used for treatment of cognitive dysfunction and memory loss associated with Alzheimer's disease. However, these drugs have some severe side effects including gastrointestinal disturbance, liver-associated problems, and GIT-related abnormalities. Phytochemical studies of Clinacanthus nutans showed a promising pharmacological effects on anti-inflammatory activity, antioxidant activity, antimicrobial activity, and immune response activity. Hence, this study is carried out to determine the bioactive compounds related to anti-acetylcholinesterase activity of Clinacanthus nutans organic extract due to no study has reported on anti-acetylcholinesterase activity on Clinacanthus nutans. The objective of this study are: the first one is to determine the percentage yield of Clinacanthus nutans organic extract. The second one is to observe the anti-acetylcholinesterase activity of Clinacanthus nutans organic extract, and the last one is to determine the bioactive compound related to anti-acetylcholinesterase activity of Clinacanthus nutans organic extract. I begin the experiment with extract preparation. As you can see on the slide, the leaves of Clinacanthus nutans were oven dried for 2 hours at 80 degrees Celsius, and then the dried leaves were grinded. The powdered sample of Clinacanthus nutans was soaked into 95% ethanol and being put on orbital shaker for 2 days. And then the ethanol extraction was filtered to get the final extraction using rotary evaporator. 2 ml of plant sample and diluent were prepared. Gas chromatography mass spectrometry was used to run the sample. Lastly, the components were analyzed using the spectrometry. For acetylcholinesterase assay, negative control and 5 concentration of plant sample were prepared, which are 25 microgram per ml, 50, 100, 200, and 400 microgram per ml. The mixtures were incubated for 50 minutes at 37 degrees Celsius. The absorbance of each sample were measured at 412 nanometer using spectrophotometer based on Elman's method. Now let's continue with the results and discussion. As you can see on the slide, Table 1.1 shows the GCMS spectral analysis of Clinacanthus nutans organic extract. There are 12 bioactive compounds which are composed of 80% and above found in Clinacanthus nutans organic extract. Among the 12 bioactive compounds in the organic extract of Clinacanthus nutans, only phytol and octadecathrenoic acid exhibited the inhibitory activity of acetylcholinesterase. According to Satya et al., phytol, PLJ, and PIS were able to disrupt amyloid aggregates, exhibit anti-cholinesterase and anti-oxidative property, and are non-cytotoxic in neuro-2A cells. According to Noor et al., octadecathrenoic acid methyl ester, which is identified in Cassia timorensis, exhibited poor to slightly moderate acetylcholinesterase inhibitory activity. Table 1.2 shows the percentage yield of Clinacanthus nutans organic extract, and Table 1.3 shows the percentage inhibition of Clinacanthus nutans organic extract on inhibitory activity of acetylcholinesterase. The obtained percentage yield of Clinacanthus nutans organic extract is 22%. A percentage yield of 2.8% was derived from organic extract of Clinacanthus nutans with a study by Zara et al. Percentage inhibition of Clinacanthus nutans in each sample with different concentrations showed a poor inhibitory activity of acetylcholinesterase acetylcholinesterase compared to the positive control of galantamine. Based on the linear regression analysis, the obtained IC50 value for acetylcholesterol inhibition by Clinacanthus nutans organoextract is 33.02 microgram per ml. According to Danasekaran et al., the IC50 value for the inhibitory activity of acetylcholinesterase by the positive control of galantamine is 2.727 microgram per ml. The difference is significant, but the IC50 value for acetylcholinesterase inhibition by Clinacanthus nutans organoextract is higher than the IC50 value for the inhibitory activity of acetylcholinesterase by the positive control of galantamine. The concentration-dependent inhibition of glycomyl pentaphylla extract was significant compared to control, but the IC50 values were higher than that of the reference drug dropenzi. At the end of this study, the derivative percentage of Clinacanthus nutans organoextract was determined with the result of 22%. The anti-acetylcholinesterase activity of Clinacanthus nutans organoextract was obtained with the value of 33.02 microgram per ml. Phytol and octadecanoic acid were identified as the bioactive compound related to anti-acetylcholinesterase activity. For the future studies, higher dosage of Clinacanthus nutans may be used to observe a better result on the inhibitory activity of acetylcholinesterase. Besides that, a thin layer chromatography can be used to get a qualitative analysis of bioactive compound related to acetylcholinesterase inhibitory activity due to its speed and simplicity. That's the end of my presentation. Thank you and Assalamualaikum.